A CCMA is preparing a patient for a stress test. Which action is most important before the procedure? A. Ensuring the patient is fasting. B. Checking the calibration of the treadmill and ECG machine. C. Asking the patient about recent travel history. D. Verifying if the patient has taken vitamins. Answer: B. Before a stress test, it is critical to ensure that the treadmill and ECG equipment are calibrated for accuracy. While fasting is not always required, machine accuracy is essential for patient safety and valid results. When obtaining a throat culture, the CCMA should swab which area? A. The tongue surface only. B. The uvula directly. C. The tonsillar area and posterior pharynx. D. The roof of the mouth. Answer: C. For a throat culture, the swab must be taken from the tonsillar area and posterior pharynx where pathogens are most likely to reside. Touching the tongue or uvula can contaminate the sample. Which of the following is the most accurate method to determine a patient's core temperature? A. Oral thermometer. B. Tympanic thermometer. C. Rectal thermometer. D. Axillary thermometer. Answer: C. Rectal temperature measurement provides the most accurate reflection of the body's core temperature. Oral and tympanic methods are reliable but less precise. A patient becomes dizzy after venipuncture. What should the CCMA do first? A. Continue drawing blood quickly. B. Lower the patient's head and stay with them. C. Offer water immediately. D. Call the laboratory manager. Answer: B. If a patient feels dizzy during or after venipuncture, lowering the head and staying with them ensures safety and prevents fainting injuries. In infection control, which type of precaution requires the use of an N95 respirator mask? A. Contact precaution. B. Droplet precaution. C. Airborne precaution. D. Standard precaution. Answer: C. Airborne precautions require N95 respirators because diseases like tuberculosis or measles spread through tiny airborne particles. A CCMA is reinforcing patient education for a diabetic patient. Which advice is most appropriate? A. You should never eat carbohydrates. B. Check your blood sugar at consistent times daily. C. Take insulin only when you feel tired. D. Skip meals if your sugar level is high. Answer: B. Monitoring blood sugar at consistent times ensures accurate tracking and helps adjust diet and medication properly. Which position is best for a patient experiencing shortness of breath in the exam room? A. Supine. B. Fowler's. C. Sims. D. Trendelenburg. Answer: B. Fowler's position, sitting upright at 45 to 90 degrees, helps patients with breathing difficulty expand lung capacity and ease respiratory distress. A CCMA notices a sterile field has been touched accidentally by an ungloved hand. What should be done? A. Cover the area with a sterile towel. B. Ignore it if the contact was brief. C. Consider the field contaminated and set up again. D. Disinfect the spot with alcohol. Answer: C. Once sterility is breached, the entire field is considered contaminated. The CCMA must set up a new sterile field. Which laboratory value would the CCMA recognize as abnormal and requiring follow-up? A. Hemoglobin, 14G/dl. B. Potassium, 2.8 milliequivalent/L. C. Fasting glucose, 90 mg per deciliter. D. Blood pressure, 118/72 mmHg. Answer: B. Normal potassium levels are 3.5 to 5.0 milliequivalent/L. A level of 2.8 milliequivalent/L indicates hypokalemia, which can cause dangerous cardiac arrhythmias. Which vaccine is most likely required for healthcare workers to prevent transmission to patients? A. Tetanus. B. Hepatitis B. C. Rabies. D. Varicella booster. Answer: B. The hepatitis B vaccine is highly recommended and often required for healthcare workers due to occupational exposure to bloodborne pathogens. The first sound heard during manual blood pressure measurement represents A. Diastolic pressure, B. Mean arterial pressure, C. Systolic pressure, D. Pulse pressure. Answer, C. The first Korotkoff sound corresponds to systolic blood pressure, which is the peak pressure when the heart contracts. Which urine collection method is preferred for culture and sensitivity testing? A. First morning specimen, B. Timed 24-hour collection, C. Random collection, D. Clean catch midstream specimen. Answer, D. A clean catch midstream specimen reduces contamination and is preferred for urine culture and sensitivity testing. Which of the following tasks can a CCMA perform without requiring direct supervision? A. Prescribing medication, B. Performing diagnostic interpretation, C. Administering vaccines as ordered, D. Making a medical diagnosis. Answer, C. CCMAs can administer vaccines ordered by a licensed provider but cannot diagnose or prescribe. When applying a Holter monitor, what instruction should the CCMA give the patient? A. You can shower while wearing the monitor. B. Avoid magnetic fields and keep a diary of activities. C. Remove the monitor during exercise. D. Press the start button before sleeping. Answer, B. Patients should avoid magnetic interference and record daily activities in a diary to help interpret Holter monitor results. A CCMA documents PRN in a patient's chart. This means A. Take medication with food, B. Take medication every 4 hours, C. Take medication as needed, D. Take medication before bedtime. Answer, C. PRN is a medical abbreviation meaning as needed. Which body system is primarily assessed when performing spirometry testing? A. Cardiovascular system, B. Respiratory system, C. Digestive system, D. Nervous system. Answer, B. Spirometry measures lung function, specifically assessing respiratory system health and airflow. Which of the following is considered a violation of HIPAA? A. Storing records securely, B. Discussing patient cases in an elevator, C. Providing a patient with a copy of their records, D. Encrypting electronic health records. Answer, B. Discussing patient information in a public space like an elevator breaches HIPAA privacy regulations. A patient asks the CCMA to explain a lab result. What is the most appropriate response? A. Interpret the lab value for them, B. Tell them to research online, C. Refer them to the licensed provider, D. Refuse to answer completely. Answer, C. CCMAs cannot interpret or explain diagnostic results. Patients must be referred to the licensed provider. Which action helps ensure accuracy when weighing a patient? A. Asking the patient to keep shoes on, B. Using different scales each time, C. Ensuring the scale is balanced before use, D. Recording weight with clothes and jackets on. Answer, C. Balancing the scale before use ensures an accurate weight measurement. During CPR, what is the correct compression to ventilation ratio for an adult with a single rescuer? A. 15:2, B. 30:2, C. 20:5, D. 10:2. Answer, B. For single rescuer adult CPR, the recommended ratio is 30 compressions to 2 breaths. Which of the following best describes the purpose of a Snellen chart? A. Testing peripheral vision, B. Measuring visual acuity, C. Assessing color blindness, D. Checking depth perception. Answer, B. The Snellen chart measures visual acuity, typically by having patients read letters at different sizes from a standard distance. A CCMA is reinforcing patient education about hypertension. Which statement shows correct understanding? A. I only need to take my blood pressure medicine when I feel stressed. B. Reducing sodium in my diet can help lower my blood pressure. C. I should stop taking medication once my blood pressure is normal. D. Skipping meals will help control my blood pressure. Answer: B. Reducing sodium helps control hypertension. Medications must be taken as prescribed, and treatment is usually long-term. Which pulse site is most commonly used when performing routine vital signs in adults? A. Carotid. B. Apical. C. Radial. D. Femoral. Answer: C. The radial artery is the standard site for routine pulse assessment in adults because it is accessible and reliable. Which of the following actions is essential when preparing for minor surgical procedures in the office? A. Keeping instruments on a clean but non-sterile tray. B. Ensuring the patient is fasting. C. Maintaining a sterile field at all times. D. Asking the patient to bring their own gloves. Answer: C. Maintaining a sterile field prevents infection and is a critical responsibility for the CCMA during minor office surgeries. A patient is scheduled for a fasting lipid panel. The CCMA should confirm the patient has A. Avoided caffeine for 4 hours. B. Avoided eating or drinking for 12 hours. C. Taken vitamin supplements before the test. D. Eaten only high-protein foods before testing. Answer: B. A fasting lipid panel requires 8 to 12 hours without food or drink, except water, to ensure accurate results. Which type of scheduling system allows multiple patients to be seen at the same time for efficiency? A. Wave scheduling. B. Double booking. C. Cluster scheduling. D. Open hour scheduling. Answer: A. Wave scheduling involves scheduling several patients at the same time, seen in order of arrival, balancing patient flow. Which of the following is considered a CLIA wave test? A. MRI scan. B. CBC test. C. Glucose fingerstick test. D. Pap smear. Answer: C. CLIA wave tests are simple, low-risk tests such as glucose fingerstick or urine dipstick. CBC and Pap smears are not waved. When applying standard precautions, which body fluid is not typically considered infectious unless visibly contaminated with blood? A. Saliva. B. Urine. C. Sweat. D. Vomit. Answer: C. Sweat is not generally considered infectious under standard precautions unless visibly mixed with blood, unlike other body fluids. Which of the following instruments is used to measure oxygen saturation in a patient? A. Sphygmomanometer. B. Pulse oximeter. C. Spirometer. D. Peak flow meter. Answer: B. A pulse oximeter measures the oxygen saturation of hemoglobin in the blood, displayed as SpO2. A CCMA is preparing to collect a capillary specimen. Which finger is most appropriate to use for an adult patient? A. Thumb. B. Index finger. C. Middle or ring finger. D. Pinky finger. Answer: C. The middle or ring finger is preferred for capillary collection because they provide good blood flow and minimize nerve damage risk. Which of the following medications is commonly prescribed to reduce high cholesterol levels? A. Metformin. B. Atorvastatin. C. Lisinopril. D. Amoxicillin. Answer: B. Atorvastatin is a statin medication used to lower cholesterol levels. Metformin is for diabetes, lisinopril for hypertension, and amoxicillin is an antibiotic. When preparing an intramuscular injection in the deltoid muscle, the CCMA should use which landmark? A. Greater trochanter. B. Acromion process. C. Umbilicus. D. Tibial tuberosity. Answer: B. The deltoid site is located about 2 to 3 finger widths below the acromion process, ensuring safe injection away from nerves. Which of the following abbreviations means before meals? A. PC. B. AC. C. HS. D. PRN. Answer, B. AC stands for anti-sebum, or before meals. PC means after meals, HS means at bedtime, and PRN means as needed. A patient expresses anger during their visit. What should the CCMA do first? A. Ask security to remove the patient. B. Remain calm and acknowledge their feelings. C. Tell the patient to stop being rude. D. End the visit immediately. Answer, B. Active listening and acknowledging the patient's emotions help de-escalate anger while maintaining professionalism. The medical term bradycardia refers to A. Fast breathing. B. Low heart rate. C. Irregular heartbeat. D. High blood pressure. Answer, B. Bradycardia means a slower than normal heart rate, typically less than 60 beats per minute in adults. Which of the following tests would likely be ordered for a patient with suspected anemia? A. Hemoglobin and hematocrit. B. Lipid profile. C. Thyroid panel. D. Electrolyte panel. Answer, A. Hemoglobin and hematocrit levels are essential for diagnosing anemia, as they measure red blood cell count and oxygen carrying capacity. A CCMA must record the time of a patient's last menstrual period, LMP. This is most important when scheduling. A. A chest X-ray. B. A pap smear. C. A vision screening. D. A glucose tolerance test. Answer, B. The last menstrual period helps determine proper timing for pap smears and other gynecological procedures. Which vein is most commonly used for routine venipuncture? A. Basilic vein. B. Cephalic vein. C. Median cubital vein. D. Jugular vein. Answer, C. The median cubital vein in the antecubital fossa is the preferred site due to its accessibility and lower complication risk. Which term describes difficulty breathing while lying flat? A. Tachypnea. B. Orthopnea. C. Apnea. D. Dyspnea. Answer, B. Orthopnea is difficulty breathing when lying down, often relieved by sitting upright. Which of the following is the correct action after administering a purified protein derivative, PPD, test for tuberculosis screening? A. Tell the patient to return in 48 to 72 hours for reading. B. Advise the patient to apply ice immediately. C. Inform the patient the results will be available in 2 hours. D. Schedule a chest X-ray immediately. Answer, A. A PPD test requires the patient to return within 48 to 72 hours for evaluation of induration, not immediate results.